So yes, my name is Councillor Salma Arif and I'm the Council's Executive Member for Adult Social Care, Public Health and Active Lifestyles. First of all, thank you very much for inviting me to talk at this celebration and launch event of the university's first 1000 Days project. As the portfolio holder for public health, I'm genuinely passionate about reducing health inequalities for children and ensuring all babies have the best possible start in life. And as Catherine has mentioned, this is one of our focused priorities in our Marmot approach, working with Professor Sir Michael Marmot and his team of experts at the Institute of Health Equity to go further and faster in our efforts to reduce health inequalities. So there are nearly 16,000 children aged under 2 living in Leeds, and their start in life is often very different. There are approximately 9,500 babies born in Leeds each year. And a third of those births are to people residing in the most deprived areas of Leeds. Now, I know this too well myself as I represent Gipton and Hare Hills, where I was born and brought up, and an area I continue to represent and am very much proud to do so. However, as you can see from this particular graph, the highest proportion of children, young children and people are found in my ward, so that's 36.1% of children that live in my ward. And this brings with it both opportunities and challenges. So in Leeds, there is a strategic sign-up to improving the health of the poorest fastest and focusing on being a child-friendly Leeds city. As a former child-friendly Leeds member, just genuinely proud of the work that we do. I was down in Bournemouth a couple of days ago and they were sort of saying how important it is that you're doing this work with child-friendly Leeds. So really proud of it. Now, the Leeds Children Young People's Plan prioritises a focus on the best start in life for all children. Before and after birth, we will support parents and babies to create the conditions where stress is reduced, positive bonds and attachments can form, and language and communication skills can develop. One way to do this is by celebrating Baby Week. The previous speaker talked about this, and I do believe it's a massive asset here in Leeds. First launched in 2016, Baby Week promotes the importance of the first 1001 days of life. It enables connections between partners across the private, public and voluntary sectors, whilst listening to parents and carers to enhance the way we work in maternity, health and early years. Over 150 events were held during Baby Week in Leeds just this year, and I know this successful approach has now been adopted across other parts of the country. Now, as Catherine has already advised, we also have an established Best Start plan, which supports partners across the city to work towards delivering evidence-based interventions to support a best start in life and sharing messages such as those the slide is talking about. So how your baby's brain develops during pregnancy, developing a loving bond by playing, cuddling, listening and talking, and the importance of parents looking after their own welfare. Now, to bring this into life, I'm going to share 2 case studies from services commissioned as part of the Best Start work. Firstly, here's one from the Baby Steps programme. The service worked with a couple where the mum had experienced care as a child due to parental alcohol dependency and had a history of anxiety and depression. She was not in education, training or employment, resided in an overcrowded property with the father of the unborn baby who was using cannabis daily due to night terrors, and his mum who was terminally going through cancer. Mum was missing pregnancy-related appointments and contacted the Baby Steps practitioner because she was struggling financially to get to the hospital. The practitioner liaised with Mum's care leaver, PA, regarding requests for financial support, and a referral was made to Cluster Services and Children's Social Care, initially for a child in need assessment, but escalated to child protection due to concerns regarding risk factors. Baby Steps also supported with travel costs to their support group as a care leaver. Mum was hesitant initially to engage with professionals due to concern that it could lead to the removal of her child, and Dad had previously had a child removed and required continuous reassurance. The family received foster placement support, which they reported to be beneficial for them. Both parents reduced cigarette smoking, and Dad was abstaining from cannabis and was accessing aftercare support. Mum and Dad both reported to be bonding well with the baby and had gained confidence in their abilities and were accessing relevant support services. Children's social care gave positive feedback about baby steps, describing them as an essential in supporting the young parents to gain skills and increasing the chances of them being able to parent their child successfully. Now, the second example I'd like to give is another service we commission, is the Infant Mental Health Service. I understand Gemma and Rhonda are in the crowd, so hello. So this is an example from their team. A 6-month-old baby was referred to by the 0 to 19 Public Health Integrated Nursing Team. Her mum was a 20-year-old care leaver who had adverse childhood experiences. The baby was subject to a child protection plan due to concerns around domestic abuse and her emotional needs not being met. In the consultation, baby was described as quiet, flat and dull in her interactions. Professionals were concerned that mum was preoccupied with the relational stressors involving her ex-partner and that baby spent a lot of time with her maternal grandmother. The consultation recommended that professionals continued building their relationship with mum to help her feel safe enough for her to acknowledge the baby's experiences. An MIH clinician met with mum and baby regularly over 6 months. Mum set goals to help her interact with baby more and to feel more confident in soothing her when she was unsettled. Initially, the work involved exploring experiences in pregnancy, birth and when the baby was a newborn. Processing this helped mum see that she had been stressed, unsafe and preoccupied, moving out of a position of blame or failure and helping make sense of it had been hard to respond to baby. The conversations helped externalise the worries so that mum felt understood rather than blamed or judged. The work then moved into thinking about how mum could pause and notice the baby and what she was communicating as part of a serve and return pattern in a relationship that builds up trust and self-esteem. Mum then began to reflect more on her early experiences where her own mum was not always able to notice and respond to her due to her difficulties with alcohol and drug misuse. The work had positive outcome as mum shared that she now knew the baby saw her as her mum, a position supported by observations across the professional network of baby coming to mum to share her delight, to make sense of her feelings and her safety. 2 very powerful examples there. Now, then after the professionals also reported much more quality interaction between them, and the baby was described as a bright, vibrant and curious little toddler, very different to the quiet and solemn baby that professionals were worried about initially. Okay, finally, I'd like to thank you all for inviting me here today. It's been a fantastic afternoon and great to hear from the breadth and knowledge and experience in the city and the collaborative approach here. Now, before I leave, as Catherine has, I'd like to invite you to the Council's Public Health team. I, along with the Public Health team, would like to invite you to join us in March. I know it's a few months away, but please put this in your diary. It's Monday the 11th of March at Leeds Civic Hall to join us. Thank you very much.